Welcome to HealthWatch, presented by Novant Health. I'm your host, June Baker. Our show features local physicians and health professionals discussing health topics of importance to local residents. Today, we will meet Dr. Ted Parcell of Novant Health Orthopedics and Sports Medicine and Dr. Kevin Cahill of the Coastal Spine Institute. Then we will learn more about Novant Health Brunswick Medical Center's new inpatient dialysis service with Jill Ward and Angie Blackwell. Stay tuned to learn about valuable health topics with HealthWatch. First, let's welcome Dr. Ted Parcell of Novant Health Orthopedics and Sports Medicine. Welcome to the show today, Dr. Parcell.
Thank you. Thanks for having me.
It's great to have you back. I know you were with us not long ago, but there may be some folks out there that didn't see that show the first time. So how about reminding us a little bit about your background and your education?
Sure. I'm initially from Pennsylvania. I did all my education in Pennsylvania prior to my hip and knee training down in Tampa, Florida, where we specialized in hip and knee replacements.
You have a fellowship in hip and knee?
Yes, that was an extra year training after the completion of my residency where I went down to Florida, and we did several hundred hip and knee replacements that year, from simple to very complex problems that were referred in from far away.
Wow. I guess from the demographic down there, there's a lot of hips and knee needs.
Most certainly. It was a great place to train because of all the retirees, and you had many transplants from the Northeast and such that were down there, and we took care of quite a large number of patients that year we were there.
So let's talk about your clinic. Now, I understand it's called Novant Health Orthopedics and Sports Medicine.
Yes, we're located in Supply, North Carolina, just a couple miles south of the hospital in Bolivia. And there we're able to take care of all our patients' orthopedic needs. And I like to specialize in hip and knee replacements.
And I understand you I know that you're fellowship trained, but it says hip and knee reconstruction. So explain that.
Yes. It's more of a fancy way of saying hip and knee replacement.
Okay.
But it involves simple problems, from just taking care of injections and other non-operative things to arthroscopy and simple surgeries, and then also gets into more of joint replacements, from the simple first-time joint replacement surgery to the ones that have had several surgeries that come in from places afar that may need additional treatment and care. And this involves both the hip and the knee. So
is it a little more difficult to take one out and put a new one in than it is to do a first time?
It is, and that was the advantage I had from doing that year in Florida, where I was able to gain that extra expertise. And I've been in practice now for 10 years and have the experience of doing that on many occasions for the difficult problems that no longer now need to be sent out of town. I'm more than happy to take care of those here locally.
I guess joints don't last forever, is that correct?
They don't. The old rule of thumb that people tend to hang their hat on is 10 or 15 years. That is not necessarily the case any longer. Our implants have evolved and improved where they're more durable and they're lasting many more years, which allows us to intervene on some of our younger patients. The old school of thought is, okay, we need to wait till patients are in their late 60s, 70s, 80s before we do anything, but now we can do joint replacements on patients much younger as the implants are lasting a lot longer.
So say I'm having knee pain and I'm taking ibuprofen and I'm just over it. I want to do something. So I'm going to see an orthopedic surgeon such as yourself. So when do I seek that medical advice? How long do I put up with this?
We're happy to see people at any time. Some people are just having some knee pain and are concerned, and I'm be glad to evaluate those patients. And I've had some patients with multiple surgeries before that come in to be evaluated. And we can initiate treatment from just having a discussion and educating the patient to medications, perhaps injections or bracing and therapy. And lastly, we would consider surgery if some of the non-operative things have failed.
So you don't jump into surgery right away. There
Most
are
certainly.
other options.
Absolutely.
You start.
I find myself to be a little bit more conservative. I don't jump right to surgery. I think it's important to try some of those non-operative things because a lot of times they actually work. I've had patients I've treated for years with injections, and I'm happy to see those patients regularly and take care of them. And when things stop working, we can take a new direction.
How about physical therapy?
Physical therapy can be beneficial in certain patients depending on their condition, but it can help patients to kind of also get to know what they need to do more on their own at home to help their overall level of fitness and their quality of life.
Well, how common is the need for a knee replacement?
Knee replacements are quite common. The latest numbers we're seeing are about 1 million knee replacements are done in the U.S. Last year.
Really?
So they're extremely common, and what we're seeing now, even since I was a resident where patients were in the hospital 3 or 4 days, and now knee replacements are being done as an outpatient in a lot of centers, or just a simple one-night stay in our home within 24 hours. And that's allowed us to take care of more patients, and we know how to handle these patients better in terms of the medications and anesthesia and everything else to get them back up on their feet and back at it much quicker than we used to.
So we've determined that I need a knee replacement. So what can I expect?
Sure. In the office, I'll talk with the patient. I will go over their x-rays, and discuss with them so they can see and actually understand what's going on. And I'll let them get their hands on the implants and see what they are so they actually have an understanding of what they're getting into instead of just a picture.
Yeah.
And also I want to describe the patient that, surgery is not without risk. We'll discuss all that and be upfront and honest with that, but also discuss expectations, what you will see in the hospital, how you're going to feel, what medications will be used, and what the subsequent weeks are after surgery, and what needs you may have at home, therapy, equipment,
There's
etc.
a lot.
It's a process, but in the end, it works quite well, and patients are very happy.
What's a typical recovery time for knee replacement?
Sure. As mentioned, most patients are in the hospital a night, occasionally a second night. We like to get most everybody home. The fallacy of going to, quote, rehab is not necessarily the case. Patients do better at home. The results are better with less issues. Therapy takes place about 3 days a week with a formal therapist, but therapy is important to be done by the patient on a daily basis, several times a day on their own. So they're responsible to take, some of that care themselves.
How long do you have to be in therapy?
It depends on how well patients progress. Sometimes it's 4 weeks, sometimes it's 6, but 6 weeks is about the average.
Okay.
And then patients need to continue, with their exercises and strengthening for a while thereafter to get the best result possible.
Yeah. So what do your patients say to you after they've had knee surgery? They've been dealing with this for a long time.
Sure. What I've found to be most beneficial is help patients' expectations up front. Give them all the education they need prior to jumping into surgery so they're not taken by surprise. They're not, oh, you never told me. No, I'll spend the time so they understand all they're getting into. But then once they've come through the surgery and the therapy, so many patients are so happy to get back to all the things they want to do.
They can do what they...
And down here, you get the patients back on the golf course and out on the beach and their boats and out in the yard. And I've had patients do highly active things through the years, including police officers.
Really?
And when I was in a former position, I had a patient who was a mechanic for one of the NASCAR teams, and he had bilateral knees in and was back to working, doing well. He loved it.
If somebody's out there and they're experiencing knee pain, how's the best way to get hold of you? What should
Sure, they can gladly call our office, and
Okay.
Our staff will try to work them in as soon as they can be seen.
Do you take appointments online?
We do, and if patients would like to visit the website, they can help choose their own appointment time that way as well.
And do they need a referral?
Depending on their insurance, some patients
That's
may, but a lot of insurances do not require referrals to see specialists any longer.
Great. Well, we've run out of time, but I can't wait to have you back because we did talk about hips today. So that's our next
We'll
topic.
save that for next time.
Okay, great. Thanks again for being here.
Thanks so much. We'll see you soon.
You're quite welcome. Now, let's welcome Dr. Kevin Cahill of Coastal Spine Institute. Dr. Cahill, we are so happy to have you here today.
Thank you for having me. It's a pleasure.
We're really excited to get to know you. I know that you have a relatively new practice in town, and we're excited to hear about your office and about you. So let's start with you. Tell me a little bit about your education and your training.
Sure. So I grew up in New Jersey and then moved to Florida at a pretty young age.
Oh.
And did my undergraduate medical school and graduate school training at the University of Florida.
Great.
After that, I then did my neurosurgery residency at Harvard, and that was followed by a fellowship in spine surgery at Jackson Memorial Hospital in Miami. After that, I then worked in Charlotte for 5 years with a very large neurosurgery group, and moved from there to this area.
So when you hear the word neurosurgery, some folks automatically think brain, but that's not the case with you. Is that correct?
That's right. So I get that question all the time. You know,
I'm
how
sure.
did you end up in Brunswick County, and how come you specialize in spine surgery? Well, you're right. Neurosurgeons do brain surgery and spine surgery, and I've always been interested in spine surgery. Even in residency, fellowship, it's just been my passion to do spine surgery. I'd never really got involved in the cranial surgery. So when we started looking for a place to open a spine surgery practice, we wanted to find an area where we could do spine surgery and have nice hospitals to work out of, and that's why we're here.
Yeah, and there's a lot of hardworking people in this area who injure their backs. So.
That's right. It really, in terms of spine surgery and neurosurgery, it's an underserved area, and patients were traveling, an hour to see a neurosurgeon, and it really was a great opportunity to provide local care and save people from driving back and forth for visits.
Right, yeah. So your practice is called Coastal Spine Institute.
That's correct, Coastal Spine Institute. Yes.
Great, and tell us where that's located.
Sure. We are just down the road from Novant Hospital. We're right across from the old hospital on 17. We're on the right-hand side going south.
South, yeah.
That's correct.
Yeah. Let's talk a little bit about the range of services that you offer at your clinic.
Sure. So basically, at the practice, it's myself and Leanne Kennedy. She's our physician assistant. We both see patients in the office about 3 days a week, and we focus on patients with spinal disorders. And we see a full spectrum of patients, from patients who walk in and say, "Doc, my neck hurts," to patients who have had 4 opinions in various cities and want a 5th opinion about their prior lumbar fusion. So we really see the whole spectrum of patients with neck and back problems. We see patients who've had spine surgery before.
That's what I wondered. Do you see patients who've already had spine surgery?
Sure. And I'd say that's probably about 25% of the patients we see. A lot of patients who have degenerative conditions in the spine and the low back also have problems in the neck, and vice versa. So we see quite a few patients who have been through the process before and are now excited to have an option closer to home.
Of the patients that you see, have most of them seen their primary care already?
I'd say about half.
Really?
Maybe a little more than that. We definitely get referrals from primary care doctors for patients with spine problems, but we also have patients who have found us and want an evaluation. So nowadays there's such a range with the different insurance carriers and policies about getting referrals that a lot of them don't require it anymore. So So we often see patients, second opinions from other practices in the area and things like that.
But you do see patients who do not have a referral? They sort of self-refer to you?
Absolutely, absolutely. We see patients who maybe fell last week and have back pain and want to come in and get evaluated. So we're happy to do that.
Mm-hmm. So if someone's sitting at home right now and they have significant back pain, you recommend that they just call the office?
Well, yeah, I mean, I think, back pain is, there's varying degrees of back pain. And back pain is very common. In fact, it's the second most common reason why people visit a doctor.
Really?
So we really get involved when that back pain is significant and it doesn't go away with time, and especially if there is any neurologic involvement, meaning your legs or your arms are not working well. So signs that this is more than your run-of-the-mill back pain exacerbation. That this is something that needs an evaluation by specialists.
Yeah. So tell me what the first steps are. A patient walks into your office, first time you've seen the patient. Where do you begin?
Sure. We like to get a good history of the pain, and we definitely are on the lookout for some of those things that we talked about, whether there's weakness involved, whether the pain goes down into the arms or the legs, whether they've had back surgery or neck surgery before. We try to get a good understanding of the patient's medical condition, and we try to do a very detailed evaluation and neurologic examination to help determine if there's any signs that the nerves are being compressed or the nerves aren't working. If those are present, it really puts you into a category where you need an additional workup step, which is typically nowadays an MRI.
I see.
We sometimes start with x-rays, but often if there's signs of a nerve not working, we move right to an MRI. And that's very helpful for figuring out what the best treatment is. The MRI will show in detail what's going on with your spine, and that's one of the main studies we use to make decisions regarding treatment.
So if a spine surgery is indicated on this patient, am I correct that you are on medical staff at Novant Health Brunswick Medical Center?
Correct. We've been doing spine surgery there almost a year. We started the practice last spring. We do surgeries on Mondays at Novant, and I've worked at hospitals at Harvard and Miami, and we have one of the most dedicated spine teams that I've worked with. We have a very, very nice equipment and really a dedicated, committed spine team. And so we've been doing surgery now almost a year there with fantastic results, and it's really been a nice place to work.
Great, that's great news and great to hear. I know there's likely a range of recovery experiences, but can you talk to me a little bit about what you would expect, what patients can expect?
Absolutely. There is a huge range.
I'm sure.
There's definitely been a focus over the last probably 10 years of developing surgeries that have a quicker recovery, and that's where minimally invasive spine surgery comes into play. Some conditions can be treated that way, and a lot of those surgeries that we do are outpatient procedures. So people go home from the hospital the same day. The recovery from those operations can be very quick, and people want to get back to work and want to get back to activities. And it may be a week or two of recovery, maybe some physical therapy, and then back to normal. Other conditions may not be that simple. And some people may have problems at multiple levels in their spine, and they may not be a candidate for a very small, minimally invasive surgery. So we really do the full spectrum of operations. So some operations, the patient may be in the hospital for several days and may have a couple weeks of recovery. But again, we try to do the least invasive surgery possible, and the recovery time for those smaller procedures can be very quick.
Well, it's been wonderful to have you here. It's great information, and I can't wait to have you come back. So if there are folks out there who would like to make an appointment, how might they do that?
Yes, so We are online at coastalspineinstitute.com. We have online scheduling.
You have a very nice website, by the
Thank
way.
you.
I've checked it out.
I appreciate that. And then we have a full office staff that
Sure.
are available during the day, and the phone number is 910-356-6100, and they'd be happy to
Great.
take an appointment.
Thank you again. It was such a pleasure.
Thank you, June.
Now let's welcome Jill Ward and Angie Blackwell. Welcome, Jill and Angie. It's such a pleasure to have you both here today.
Thank you. We're excited to be here.
Yeah, it's a great topic, and I'm excited to hear about this. So, Jill, you've been on the show a couple times, so folks out there probably know who you are, but remind us a little bit about you and what you do at the organization.
Yes. Well, I am over all of nursing at Novant Health Brunswick Medical Center. If you're a nurse or you're a CNA or a tech, you kind of work under my umbrella. So I'm actually the chief nursing officer there.
Great. And how about you, Angie? Tell me a little bit about yourself and what you do at DaVita.
Sure. I'm a group hospital service administrator for DaVita, and I cover the entire North Carolina. So what I do is I oversee the acute departments for DaVita.
And acute meaning
Acute
folks who are in
dialysis.
the hospital?
Correct. That's right.
Well, I know that that program was recently begun at Novant Health, so I'm excited for our community to know about that. So I understand that it is a relatively new partnership between these two organizations. So Jill, tell me a little bit about that. How did that occur?
Last year, 2019, the beginning, we started kind of having conversations with DaVita, with Southeastern Nephrology, our group that's on campus with us, and just started talking about how can we make this happen for our community, bringing us a new service line to our hospital. So we had many meetings and did some walkthroughs and just talked through things and what we would need to start a dialysis program. And so this year it actually came to light. January 13th was our original start date, and we've done really good.
Yeah.
Very excited.
And what does this mean for the patients in our community to have dialysis here at the hospital?
Well, it means that they won't have to be transferred to another hospital outside of the county. If they're having any type of procedure and needing to stay overnight in the hospital and they're a dialysis patient, we can offer the services so they don't miss their treatments. And
before that, they would have to go to like the tertiary care facility.
Absolutely.
Right. Yeah.
In order to have or maintain their dialysis.
Exactly.
Correct?
Correct.
So are there limitations to the type of patient that the hospital can take care of?
No. We will see any patient in the hospital that needs dialysis, no matter who their provider is.
And so is that decision made by like the hospitalist team? Do they oversee that, or how does that work, Jill?
The hospitalist would consult nephrology, and then they would see the patient.
And then nephrology
would write orders for dialysis.
Well, Angie, tell me a little bit about your team and how that service works at Novant Health Brunswick Medical Center.
So what we do is we bring in a specialized care team to partner with the hospital caregivers to deliver dialysis and make it easy and accessible for the patients in the community.
And so when you're delivering these services, is it your team members are there with the patient and the equipment?
Exactly. So what we do is we do the entire treatment and we stay at bedside with the patients. We never leave.
And how long does a typical treatment last?
So typical treatments last 3.5 hours to 4 hours. It could be less, it could be more. Depends on what the output of the patient is, and lab work. It's a lot of things that doctors use to measure what the actual amount of time that patient would need.
Now, does the nephrologist stay at bedside, or it's The DaVita team.
It's the DaVita team. For new starts, the nephrologist may be in the building or nearby just to make sure that everything goes well. But they are only a phone call away. If
Right, they are.
Yeah.
Yeah, they're just down the street.
Right.
Usually. So Jill, tell me, how are the nurses and the doctors responding to this new service at the hospital?
Very excited.
Yeah.
Anytime you're a nurse and you work in a facility where a new service is offered, it's really, really exciting because the nurses get to get a lot of education, and so it helps them.
They probably learn a lot of new stuff,
Yeah.
but do they do anything in terms of dialysis, or they just continue the regular nursing care that they're doing and DaVita takes over?
Right. They continue the regular nursing care that happens. They administer their meds. They do all the things they typically would, but they get to really work with the DaVita nurses because they can kind of see what DaVita's doing and
That's kinda cool.
just help them monitor the patients and just make sure that everything's going smoothly. So they work really close with the DaVita nurses.
That's kinda
so it's
cool.
fun and exciting when you get to learn a new
Something
service
new.
line.
Yes.
Yeah, it puts that in their, not sure what word I'm
It's
trying
sort
to
of
say.
in their bailiwick of services.
Right.
Well, this is a dumb question, but can you eat while you're having dialysis?
Well, normally, no. We don't like for patients to eat because
Okay.
sometimes they get sick on their stomach and, have some gastro
I
issues
see.
going on. So
But they can like read books and
They
watch
can.
TV
They
and all that
can.
stuff?
They
Like
can. Yeah.
Puzzles.
Yeah.
Yeah, absolutely.
Just something to pass the
Talk to
time.
us. Like we get so much out of just sitting at
Yeah.
the bedside talking to patients. We learn about their families. They learn about ours, and so it's a time to bond. So and that's why we love it so much because of those patients.
Yeah. So up until this new partnership, then if we had a community member who was really sick and coming to the hospital, they couldn't even come to Brunswick. Is that correct?
Correct. Our EMS would transfer them to a facility that actually provided dialysis.
And so now that's all changed
That's
for
right.
the residents of
That's
Brunswick
right.
County.
That
That's
has
right.
changed.
They can be cared for right there at Brunswick and know that DaVita's expert team will be on site to support them.
Yep.
That's awesome.
It is awesome.
It is.
It's exciting.
And how about the equipment? DaVita brings the equipment
Right.
with them, is that correct?
Right. Well, we purchased the equipment. The equipment stays in the hospital.
Oh, okay.
Yeah. So when we get there, we just pull the equipment from our room and just set it up and do dialysis.
Oh, that's what I was going to ask. So they don't have to move from one room to the next.
No.
It's right there in their own bed, right?
right. That's right.
Right.
At bedside.
Oh, wow, that's great. Well, before we wrap up, that's a lot of information, is there anything else that you would like community members to know about this new service? I think we've pretty much covered it, but
I think we have. It's just really something that's exciting, and they can stay in their hometown. Actually.
Exactly.
and it's good for their family and stuff.
That's right.
They can
Absolutely.
come visit and maybe sit and talk to them for that 3 hours.
That's right.
They're
Absolutely.
Sort of a captive
Yeah.
audience. Well, thank you both for being here today.
Thank you.
Thank
It was a
you.
lot of good information, and I'm glad that we're able to provide that service to the residents of Brunswick County.
Thank
We
you
are
so
too.
much.
Thank you.
Thank you so much. Thank you for tuning in to ATMC TV's HealthWatch. I hope this information was beneficial for you and your family. If you have any questions or topics that you would like to see discussed on a future show, please email them to atmctv@atmc.com. Visit novanthealth.org for more information on Novant Health Brunswick Medical Center, local doctors, and general health information. Thanks again for joining us today. Be sure to join us next time for HealthWatch on ATMC TV.
At ATMC, it's all about you. Yes, you. Build your own bundle at atmc.com and get faster speeds, more choices, and bigger savings. Like faster internet with speeds up to 1 gigabit, which makes streaming ATMC's Merch TV a breeze. You can even control your lights and locks from anywhere and save big on home phone and wireless. See? It's all about you. Build your bundle today with ATMC.
This is ATMC TV, your community channel.